Welcome, everyone. Thank you for joining us for a conversation about conducting informant interviews with the Georgia and Mississippi MMRC teams. I love this title, Paving the Way in Georgia and Mississippi. We're really honored to have these innovators here to share the wonderful work they are doing down here in the Southeast. I'm just going to do some brief intros and let them get started. So this is the Georgia team. Courtney Daniels is a licensed clinical social worker working as an informant interviewer for the Georgia Department of Public Health's Maternal Mortality Review Committee. Courtney has extensive clinical social work and program development expertise in the maternal child health arena, including hospital, insurance, and community settings. Courtney is also a certified perinatal mental health provider and bringing baby home educator. She holds specialized training in grief and bereavement, intimate partner violence, and motivational interviewing. Courtney received her Bachelor of Arts degree in sociology from Butler University and her Master of Arts degree in social work from the University of Chicago. She is joined by Dr. Michael Kramer. He is a maternal and child health social epidemiologist with research interest in social contextual determinants of geographic, racial, and economic disparities in maternal health and infant health outcomes. He is the program director of the HRSA-funded MCH Center for Excellence and principal investigator for a CDC-funded project developing and evaluating the MMRC Health Equity Toolkit. And for the Mississippi team, we have LeJeune Johnson, who has been a practicing social worker for over 12 years. Since 2014, she has provided psychotherapy, innovative counseling, and life skills coaching as a licensed clinical social worker. In 2006, she received a bachelor's degree in social work from Mississippi State University. She later attended Jackson State University and acquired a master's of social work degree in 2008. In 2017, her passion for working with trauma survivors led her to complete a trauma-based graduate program at Mississippi College. In 2020, LeJeune joined the Mississippi MMRC team as their informant interviewer. And last, but certainly not least, I introduced Dr. Charlene Collier. Charlene is the director of the Mississippi Maternal Mortality Review Committee and the Mississippi Perinatal Quality Collaborative. She is an associate professor of obstetrics and gynecology at the University of Mississippi Medical Center, where she practices general obstetrics. And this is a wonderful dream team to have with us today. So please.
Thank you, Julie. And thank you all for attending and joining us so that we can share a little bit about our role as informant interviewers and how this role came to be in both Georgia and Mississippi. I'd like to just give a very brief overview of how we got started, and then I'm going to pass it on to LeJeune and Dr. Collier to share a bit about the process of completing informant interviews. Last year, both LeJeune and I joined our local MMRCs in the informant interviewer role in a part-time role. So we are both licensed clinical social workers, and I'm going to be speaking to that later on, really the benefit and the impact of having a social worker in this role and advocating for other social workers. And really how we came to be in our roles is in both Georgia and Mississippi. Our legislation specifically states that the MMRC will complete interviews as a way to collect additional relevant data in MMRC review. So the goal of an informant interview is really to gain a more complete story of a woman's life and her experiences than is available in medical records alone or other records that we have access to. By doing this, by capturing a woman's story, this really facilitates a more comprehensive case review within our maternal mortality meeting, specifically enhancing learned information of contributing factors, perhaps barriers to care, access to care issues, specific experiences of discrimination or racism, and thus allows us to make more effective recommendations for prevention. We developed our process both in Mississippi and here in Georgia by referencing the CDC's Informant Interview Guide, which is posted, I believe somebody shared it in the last session, And I would definitely encourage you to take a look at that on Review to Action. But we both use this guide to really assist our process of completing outreach, specifically putting together our outreach letter, resources, and really adjusting the interview guide to fit what we needed for our specific MMRC process. I will comment that both LeJeune and I love to talk about what we do together. But part of what was so important to us in starting this process was really making the interview process a conversation for these families versus a very formal interview or questionnaire. So we'll be speaking to that. And I'm going to pass it over to Dr. Collier and LeJeune to share their process.
Thank you so much, Courtney.
Thanks, Courtney. So, there is a lot that goes on behind the scenes as it relates to informant interviews before the case actually makes it to my desk for review. A lot of common questions that we get are things like, what kind of cases do you pursue? What kind of cases do you exclude? What does the case abstraction process look like? And so Dr. Collier, our medical director and our chair of our MMRC, is the perfect source of information to kind of share with you guys the behind the scenes things that go on regarding informant interviews before it actually makes it to the informant interviewer's desk. So I'll go ahead and let Dr. Collier take it from here.
Thanks so much, LeJeune. So we started our MMRC with the new legislation in 2017. And prior to that, we were solely working with birth and death certificates. And so it was a huge win to pass our legislation and finally gain access, to complete access to medical records. And that seemed like everything we needed to review cases, and so much more than what we used to have. But the more and more cases we reviewed, the more medical records that I personally went through. You can see there, you can go through an entire medical record and never really hear or represent that mother's voice of what she actually experienced that day, what her feelings might have been, how was she treated by the medical staff. The medical record is one side of the story. And although things like vital signs and when and how certain treatments are given are points of fact and they happened, that true interaction really is not captured. So that was one of the biggest things, that we were not getting the full side of the story. And there were some deaths for moms that we really had to know what happened in that interaction. And that's really a big part of that motivation, particularly as we were struggling as a committee and dealing with those issues of how do we reflect and capture racism and discrimination in that interaction. And the medical record is not going to make that a glaring reality. And so we knew if we wanted to really understand what happened in those moments, we had to do something to be able to hear that mother's voice. And the best thing we could do was certainly begin those informant interviews. So this has been an iterative process. We've been learning as we go whether or not we want to have all the records ready and the case completely reviewed before we pass it to our informant interviewer, LeJeune, or if she can start before we do. But our intention is to interview every family. We do not review motor vehicle crashes, so we pretty much exclude those. But apart from that, we look at homicides, suicides, overdoses, and medical causes. And if we suspect it's going to be reviewed, then we want there to be an informant interview involved, because we feel like without that, we're not really getting the whole story. So we have done a combination of having the abstraction completely done, where we have pointed questions to pass to LeJeune saying, like, please be sure to touch upon these points with the family. We really want to know. Or there have been times where she reviews them before our abstraction is completely done. And I think having some flexibility in the process is really important. And with that, we do go back and forth where LeJeune shares information with us, and that helps us to then go look for more information to abstract. So it's not just a one-sided component. We learn that the mother may have visited several other ERs that we did not abstract, so then that kicks off an additional review. So it is an absolute team-based approach, and there are several cases that we've reviewed that we would have had zero medical information, where the medical record was absent or missing, or we couldn't get it from a hospital, or that the information was really sparse, but then the family was able to share. So we take our list from the beginning of the year, go through it, and get that information right to LeJeune, and then she then has that time to begin reaching out to families, because we know that's a long process. And so just scheduling those can take time. So we, when we're thinking about how many cases we can get through, we do think we can reach having all families interviewed. And that's really our goal. So LeJeune, once you take it over, that's where the real work begins.
Thank you, Dr. Collier. I just wanted to really take a moment to express, how excited I am to talk to everyone about our journey in Mississippi towards incorporating informant interviews into our process. It's almost been a year of us doing, well, I will have been a part of the team almost a year, pretty soon in this summer. And so it's almost been a year of incorporating informant interviews. And so when I first started, the first thing you want to do is to reach out to other state MMRCs and ask them what they're doing, what's working for them, what their process looked like. But unfortunately, it just wasn't a lot of MMRCs doing informant interviews at that time. And so when Courtney and I, kind of stumbled upon each other, it was like a breath of fresh air to be able to collaborate with other professionals that are engaged in the same type of work that you're doing. There is certainly value in collaborating with other MMRCs to get insight as to, their triumphs, their struggles, their challenges, what's working for them, what's not working for them, and kind of bounce ideas off of each other. And of course, Courtney and I have become close and have done that so many times, in the months that we've known each other. I think it's important to also note that, like Dr. Collier said earlier, that, our process of informant interviewing it's forever evolving. It's forever, changing, because, we are learning as we, in real time. We're learning in real time, and we are learning best practices and best approaches of engaging in outreach with these families as we're doing it. We're learning the best approaches and actively carrying out the informant interviews as we carry them out. We're learning, what are the best post-interview resources to provide these families with, and follow up to provide these families with after the informant interview has been conducted. So we're always evaluating our process, coming together back to the drawing board and discussing what's working, what's not working, what can we, what can we improve to make this process more comfortable for our participants as well. And so with all that being said, I'll now go into the phases of the informant interview process. And again, Courtney and I have kind of talked about, what our informant interview process looked like in Mississippi and what their process looks like in Georgia. And Courtney and I both, again, are social workers. And what we've discovered is that, the phases of the informant interview process is very typical or standard to, most interviews or assessments that social workers conduct with their clients. But the twist is that each phase of the informant interview process really requires the execution of tasks specific to the needs of that MMRC. So I'll briefly talk about each stage and kind of the tasks that go along with the MMRC tasks that go along with that stage. So, of course, the pre-interview stage is your preparation and planning stage. You're getting ready. So, I received my cases that I need to start conducting outreach on. And so during this stage, I'm really getting to know the decedent. I'm really doing a comprehensive review of the medical record to get an understanding of, what it was like in that, or what it was like, when she made it to the hospital, what happened in the OR, or what happened in labor and delivery. I'm reviewing the death certificates. I'm reviewing fetal death certificates. I'm looking at everything and anything I can to familiarize myself with that mother. I'm also preparing our outreach resources that we're going to mail out to the family. In Mississippi, we send out an outreach packet to the identified next of kin before we actually follow up with a phone call. And I'll also talk about our outreach efforts and our outreach process a little bit later on, but that's really what the pre-interview stage entails, just the setup of initiating contact with that family. And the next stage is the active interview phase, where we're actually, following up with that family to conduct an interview, to schedule an interview, to get them to buy into our process of participation in the informant interview process. We're also educating them a lot. We're educating them about those forms and resources that we sent them in that outreach packet. That's why sending the outreach packet is such a good segue into actually calling them and talking to them. Hey, this is LeJeune with the Mississippi State Department of Health. I sent you an outreach packet a couple of weeks ago about your daughter or about your sister. I'd like to talk to you a little bit more about what I sent you. Also, them having those forms in hand is important because you can reference any questions they may have about the packet. Answer any questions about confidentiality. Answer any questions or concerns they have about, participation in the informant interview process. And then, of course, in the interview stage, you are actually actively conducting the interview. The interview process on average is anywhere from an hour to an hour and 30 minutes. It really depends on your informant, how knowledgeable they were about the circumstances of the death of the decedent. The closer that they were, the more information, the more lengthy that interview is bound to be. And then, of course, that leads us to our post-interview stage, which is really the wrap-up, the completion of your encounter with the informant. And this is you providing a descriptive account of what occurred during your interview with the next of kin. Now, in Mississippi, our practice is to try to record every informant interview. We advise them of this in our outreach letter to them. And of course, when we're talking to them to conduct or schedule that informant interview. And most families are on board with that. And if they do express a concern or just are adamant that we don't record, of course, we will respect their wishes. But having the informant interview recorded is a great opportunity because it allows you to go back and as you're, providing your description, it helps you with documenting your narrative. And then in addition to that, our medical director, Dr. Collier, has the opportunity to listen in. And, I don't have the extensive medical background that Dr. Collier has. So she's able to listen in and to pick up on things medically that may need more clarification, or we may want to revisit information about particular things in the interview that I may have missed because I don't have, extensive medical background. And of course, we always follow up with our participants with post follow-up resources. And I'll talk about our post follow-up resources that we provide families a little bit later and the importance of that. And we, of course, extend to them a very warm thank you note. Thank you so much for your participation, and let them know how valuable they are to saving lives and improving the maternal health care system. And so, all of those things are kind of briefly a wrap up of what we do in each stage of the informant interview process. And I don't want to forget this. We also document the narrative in Maria as well. So yeah, that's about everything, mostly everything when it comes to the process of informant interviews.
Thank you, LeJeune. I'll mention just two additional things that I think are important to note. For us, I think this is a frequent question that we get in the process of how we started the informant interview role in our states. But a question that comes up is, did you have to go through an IRB? And how long did this process take to get started? And for the two of us, we did not go through IRB in our respective states. I will say in developing documents and the process, there was a lot of collaboration with our communications department, our legal team, but we were really able to move things forward fairly quickly. There's, some graphics and branding and different kind of internal structures that had to be put in place. But I do like to mention that because it is a question that comes up. And then I would say, just for us specifically in Georgia, I do complete all of our interviews while our abstractors are actively abstracting a case. So we're working in conjunction with each other. We're sharing information, reviewing information together. What that allows us to do is to incorporate the interview into a case narrative, which is then presented to our MMRC at our committee meetings. So it's really a full picture and presentation of a case that's given. As we move on, we did want to highlight just the benefits of being licensed clinical social workers in this role. So the benefits that we feel day to day in the work that we're doing, but I also believe the benefits of this on our overall success and impact of interviews. The biggest thing and a big question that often comes up is, how do you even start this conversation with somebody? When I started, we were reviewing, 2016, 2017 cases. So these were cases that were 3-4 years old, and I'm calling families, very unexpectedly. But such an important skill in this role is really to be able to establish rapport with people. There's oftentimes a lot of shock and hesitation in the first 3 minutes of a phone call with somebody. So really being able to navigate that and support them through that hesitation, give them time, help further explain things, has become so important. I've mentioned several times that I feel if we weren't able to do that, a lot of those interviews would not have happened if you just kind of say, oh, okay, I'm so sorry, I understand. So being able to support somebody and kind of navigate those circumstances is really critical. That goes into motivational interviewing as well. There are certainly families that you engage with who just want to answer questions with 1 or 2 responses, be pretty closed-ended in their responses, and really being able to elicit more information, focus on open-ended questions is important. Of course, cultural competence is important. Just one example that I can think specific to that is, when asking families about mental health history, history of depression, experiences with postpartum depression, there are definitely certain cultures out there that don't relate to that terminology. So being able to really understand a family and be competent when it comes to things like that is so important. A few other things, LeJeune and I both have experience in trauma and grief. Certainly the family members that we are talking to are still grieving. We wanted to be mindful that we could be putting them through more trauma by having to relive this experience, tell this experience. And so to really be able to utilize some grief counseling skills has been helpful. There are certainly a lot of difficult emotions that come to the surface during these interviews. I hear a lot of anger, a lot of regret sometimes, very, very raw grief. Many people do get very tearful and emotional throughout the interview. So really being able to support those emotions and understand where those emotions are coming from is essential, as is the importance of being able to identify any needs that there might be for resources. And LeJeune's going to talk a little bit about resources, but that is such an important part of this role. Many of these families, mentioned that they struggle to get benefits for their grandchildren that they're now raising, or that, they're struggling with their grief and they never had the opportunity to engage in counseling services for themselves. So picking up and listening to their needs throughout the call is also very important. And those follow-up resources that we do provide, they have to be tailored to each unique situation in each call. But they're really valuable for those families. And I think that's one of the things that many of the families appreciate after going through this process and participating. So okay. You for some challenges that we experience.
Yes, and I actually saw some questions in the chat about some of these things, but in particular, there are some inherent challenges that come along with pursuing informant interviews. And going back to what Courtney was saying about gaining our participants' trust, that is very huge. This is a very intimate process. We're asking, these individuals, our informants, to relive a very uncomfortable time in their lives. And we're asking them to buy into this process of participating in our informant interviews. We're asking them to become a stakeholder in our goal of improving maternal health. And so just like Courtney was saying, when you're calling these families, regardless of the circumstances of their death, of their loved one's death, the fact remains that someone died, and it was tragic. And along with that tragedy come, a lot of different emotions: anger, deep sorrow, resentment, being depressed, and like Courtney was saying, even still grieving at the time of calling them. And so, then we're tasked with the agenda to try to compel this family to participate in our process. And yes, it's most definitely a challenge. Another challenge that we sometimes encounter is inaccurate contact information. I saw someone talking in the chat about how they're going back and, working on potentially looking at working old cases. Mississippi, we just wrapped up our 2018 cases, and we're in 2021. And so the more time that has elapsed between the date the person expired to now offers more opportunity for the contact information in that medical record to be inaccurate. People change phone numbers, people relocate and move, individuals remarry, they move on. And so, 3 years later, the number that's in the medical record is not that person's number anymore. And so that presents a challenge for you as to try to track this person down and look for them to carry out that informant interview. I don't know if we can just go into the questions or...
Actually, thank you so much. This has been so wonderful. There have been quite a few questions, and I've been kind of organizing them thematically to try to get through them before the top of the hour. I just want to mention that actually 2 or 3 folks asked whether you do just one interview per case, or do you ever do more? And do you conduct multiple interviews at once? Like, do you meet with multiple family members at once, and then how do you select them?
I have done all of that. So there are a majority of cases I'm conducting one interview. They are most commonly with a spouse or a parent. But I also have several cases where I've conducted 2 interviews. And in those cases, it has been with both of those individuals. So a decedent's mother, for example, who can give a lot more history into life experiences, potentially past medical issues, and then to supplement that with a spouse interview, which really tends to focus more in the current situation before her death, is helpful. I have completed calls with 2 people on the interview at the same time, with a mother and a sister. So I think that's the benefit of being really flexible and being able to tailor our interviews to what the family needs as well, and what would be helpful for them.
Mm-hmm. And it definitely points out, you don't know from the medical record who was actually there. You don't know if it was the mother, the cousin, the sister, the father, the baby, and you're really starting on those certificates and have to work your way back. And for many of our moms, if they're not married, that significant other may not be mentioned, or they'll be on the birth certificate. So it does take some, connections that you have to make. But and you never know the extent of a relationship. I have contacted family members who tell me, you know what, I think it would be better for you to outreach to my other sister or her grandma.
lived with her grandmother, and that was, you know, the person who was most involved in her life.
Great. Another FAQ was the time period, right? Some states are really trying to get caught up on reviews, and then some are more current. Do you have a standard that you pursue in terms of timing and contacting the family after a death?
I can say here in Georgia, we are currently reviewing 2018 cases and focusing interviews on the cases that we're actively reviewing. So we are one of those states that have been working very hard to get caught up, and we review 2 years worth of cases per calendar year, which equates to about 160 cases. And so, you know, that was a concern, how far back these cases were. We've talked about what it will feel like when we do get more current. LeJeune, I don't know if if it's been different for you.
We're working on it. We just wrapped up 2018 cases. I know this year we're hoping to get into 2019 and 2020. But other than that, I mean, no.
And I think this is where talking and having family members on your committee or access to, because really when, you know, if you hear from them that they want to tell their story, it doesn't matter if it happened in 2003 or 2000, like families lost, you know, a very dear loved one, and they had a story to tell that no one ever cared to ask. And so this person, you know, so I think it's something we're learning, and we want to be sensitive and timely. But if we learn and hear from family members that, like, it, you know, it doesn't matter how long goes back. I would have gone back to 2013, but there was a timeliness factor. We started our cases in 2016. That, you know, we were on 18, which we thought about just starting right at 2020. But, you know, we were doing our reviews, and to add that to a report, we just went ahead with 18. So start somewhere for sure. But I think if you do have family to talk to too, that helps guide. But I think from our experience, we've got a lot of positive feedback from family even from 2 years back.
That's
I
great.
think a lot of families are so grateful and have found the timing to be helpful for them, and have commented that if it were sooner, they're not sure they were able to participate in the same way.
Yeah, great. You know, there's so many questions, and I think we might have to circle back and maybe upload things to the resource tab if you all are willing to share some of your outreach packets and such. But I did see a question that came up in a couple themes, is whether you've had to extend the length of your review meetings with these additional qualitative data.
Michael,
Dr. Kramer, maybe you could speak to that, just having the experience pre-interview and now that we're doing interviews, and speak to the impact a little bit.
Yeah, but additional information does take more time, but I think it's really valuable. And I think we could also always reimagine how to balance our time. Do we spend more time than we need to on clinical things that aren't ultimately going to change aspects of the decision? So I think there are times when this key informant interview really meaningfully changes the things that the committee decides about, whether this was pregnancy related, whether this was preventable, what were the contributing causes, what are preventive actions. And that's the focus of what the committee should be doing. So it may extend time, but I think it's really valuable. And I think we can always reprioritize our time, keeping an eye on our goals.
Yeah, and sharing with committee, like pre-reading, that's one way, like definitely add it to our length, but I think we'll be better about trying to get them out so people can read them in advance and we just talk more about it. But definitely 100% worth it. I would take the family interview over lots of parts of the medical record any day of the week, because I mean, it really adds so much context to what really happened.
Wonderful. And, you know, just I think one more before we have any closing notes. There was a couple of questions around any awkwardness or shame that folks might feel discussing certain causes of death, perhaps around suicides or overdoses. Is this something that either of you have come across in your work?
I think that.
I don't know about you, LeJeune.
Well, I think it's an emotional process for the participants. And I have had informant interviews with overdose cases, and ultimately they turned out positive. The family was happy that they participated. You know, we talked about the challenges of getting our families to participate. A lot of times, it's all about perspective. We tell these families that, the information that you have to share about your loved one is valuable. The information that you have to share could potentially save someone else's life. Another mother would be able to go home with their baby. By you sharing this information, it could improve that maternal health care system. And, when you talk to families and potential informants like that, a lot of times it changes their perspective. It's like, well, if I can share this story and it will help someone else, or it'll prevent something like this from happening to someone else, I really do want to participate. I really do want to be a part of that. So I don't think that that has impacted us in a negative way. I do think that post-interview resources for that family should be tailored to, support for survivors of overdose, for sure. But I don't think it negatively impacts the outcome of their participation.
Thank you all. We are going to move into our breakouts, or some of us are finished with our days. Thank you so much for joining us. We really appreciate the wonderful work you all are doing.
Thank you.
Thank you.
Bye.
Feel free to reach out to any of us. We're happy.